I'm Sophie and this is my story. I have a rare form of cancer at age 9. My mum started a blog about me and my journey. Later on I decided to make a TikTok account which I love. I have to go to London for 6 weeks for radiotherapy very soon. Not that much, it's just that I haven't got hair. What was the question?
Have you overcome it?
Yeah. Because I used to be scared of needles. Now that I've had so many, I'm not. It's gone amazing. Especially on TikTok.
Are you happy that it happened?
Yeah.
Are you happy that lots of people know about it?
Yeah. And I'm happy I haven't got any hate. Going to hospital so much. Because I've only ever spent one night. No, not even a night. Less than a night. Well, if I'm outside, I would like to. I want to if I'm seeing like someone else. But if I am in the house with just my family, I don't really. I'm decent about school. I don't really want to go back. But at the same time I do. They're very big. I started them because, so at hospital, I was obviously bored, because that's what I am always in hospital. And then they offered me to paint a ceramic, and at first, I did terrible, but I managed to sell one to this doctor for £10, and then it just started a massive business. The COVID swab. Well, I want to go to Australia, but I don't want to see any spiders or snakes or any chemo easier. As the parents get food. Hi!
Ladies and gentlemen, Sophie Fairall. So we have our panel here to speak about children's and young people's food. And it only seemed right, I think I'll come up here if you don't mind, it only seemed right to let people hear that little bit of a story from Sophie. And Sophie has driven so much of our change. And hopefully most of you know that story, but I guess there will be some that don't. And no better person to share a little bit about Sophie's story than her mum, Charlotte, who's here today, and chief exec of Sophie's Legacy, which is an amazing charity, and we're incredibly proud. So just tell us, I suppose, a little bit about how that happened, what's going on, and where are we now?
Yeah, so Sophie had cancer, which obviously, she did that video without me knowing, with her sister actually, and showed us afterwards. But she sadly died from cancer, age just turned 10 in September 21. She knew she was dying and wanted some change made in her memory. She wrote a bucket list of things. And some of those are things like she wanted parents to be fed when they stay in hospital with their child. She wanted there to be improvements to children's food, because she described the food that she had in hospital as disgusting. And she actually went on a bit of hunger strike when she was in there. She said the food was so bad, I'm not eating until you get me discharged out of this place. And she wanted there to be play. As you heard, she was bored all the time. And some changes to children's cancer, which we're working on. But Phil did actually get to see her, and he's been, before she died, and we've been working together a lot to try and make national change, because although we're trying to look at, we're based down the south near Portsmouth, we're obviously immediately covering lots of hospitals in there, but Sophie wanted this for the whole country and made me promise her that I will go ahead and make those changes for the whole country, because she said, what about all the other children, all the other parents? You have got to change it for the whole country. And that's why we called it Sophie's Legacy, because she's my big boss and gets me up every day.
And it works.
Yeah.
It works, doesn't it? Because it's exhausting, isn't it? when you're trying to drive a message, particularly if you feel that people aren't listening. And what we will do, Charlotte, afterwards, because you and I worked on it together, is that mapping out of the sites. So the plan is to send you a PDF of the new children's book to everyone that was here today. And we'll also send you a slide where there's a mapping out of all of the pilot sites that Charlotte led through Children's Alliance and NHS England. We've got the MediRest team and the sites that they've been leading. And then we've got all of the other sites that we visited to try and kind of, get them moving. Have a look at that and see where you are. If you're not on that map, first of all, why? Is it because you're already doing an amazing job? Or is it because you need some help and support? And if you are one of those dots, and yet you've gone back and you're not doing what your children and young people need at ward level, then please have a rethink. Katie, I came to visit you up in Northumbria. I've never been so far. It was a wonderful site. I know that Tim was also there last weekend. What a great site. I was overcome with the amazing stuff that you're doing up there. Share us a little bit about some of the challenges, first of all, that were before you.
Well, the challenges are obviously the facilities. So how do we accommodate 30 patients' meals as well as parents in the hospital? We just don't have the facilities, so we looked at how can we create a space and create a hot, nutritious meal for a parent while their child's in hospital. So that was definitely one of the challenges, but I'm proud to say that we've achieved that now.
And you can't do it on your own, obviously. What sort of relationship did you have at ward level? Is it something you had to build on, or was it already there?
It was already there, so we work very closely with the wards and departments and constantly look for improvements. We always do patient surveys. We ask parents, we ask children, what do you want to see? How can this experience be better for you while you and your child's in hospital? And we build on that, and that's what we work from.
And Richard, across Sodexo, I guess you face some of the same challenges. Do you think you go about it a different way, or more collectively, or not?
No, totally. So when we started with we originally got it come to us to ask, and the biggest challenge we had was trying to understand what the ask is. And there were so many people that wanted to get involved, from obviously Sodexo and the Trust as well. And it was trying to find out the right stakeholders. Originally, we had the Trust going to all different supermarkets, Tesco's, Asda's, Sainsbury's, trying to get donations in. And there was the risks of transporting the food. But then as Sodexo, we stepped back and looked at it and said, hang on a minute, what is the ask? And that's when we spoke with yourself. And we said, right, it's just cater to parents. And that's when we said, well, hang on a minute, we're already providing to thousands of people a day. We've got menus already there. And that's when we built the menu.
So do you think we overcomplicate it sometimes?
100%. It's such a simple process. Originally, we was looking at creating our all separate menus, and it was the logistics of how many staff do we need? Do we need to get extra people in? Obviously, the cost is a massive factor of it. But in the end, stepping back, looking at keeping it simple was the key part for us.
Yeah. And Saachi, what we have to make sure stays at the top of that agenda when we're creating good food for whichever age group is the nutritional value, isn't it? What are some of the challenges that we see, particularly around the nutrition, the portion control, service levels, all those things? What do you tend to have to battle through sometimes?
I think it's really difficult with some of the things around for children's food, because I think it's really easy to say, okay, we've got a children's menu and it mimics the adults menu. We have to think that these are tiny humans. They're little kids that need different nutrition. Their nutritional asks are different, their tastes are different. And you just have to bring it back to what does that food look like on a plate. One of the great things about offering parents food with the children is that it mimics something that they're familiar with at home. So we know that children children that eat with their parents tend to eat more from their plate. So it's how can we do that in a hospital environment where we know that children's appetites are not going to be great? Can we give them a food alongside their parents so that they can be encouraged to eat and drink when they're not feeling like they want to? And then it's just making sure that we understand that children come, from little kids to young adults. And it's making sure that we provide menus that meet all the nutritional needs. Someone that's 2 is not going to need the same meal as someone that's 12. So it's making sure that whatever we're offering as a menu is providing the right nutrition for their age, the right choices, but everything around it as well. I think it's really important that the nutrition's right, but the service alongside it, so making menus a bit more friendly, making sure that little children can navigate the menu, making it fun, and then looking at the service as well, making sure like things like the plates are right. We've spoken about the blue crockery for elderly patients and how that encourages them to eat and drink. The same as with children. We've got to make sure that we have something that looks good on a plate that's going to encourage them to eat and drink as well.
And something that obviously doesn't happen very well, because when we have something like a listeria outbreak, for example, we end up getting a couple of hospitals on the line, and the first question we ask is, well, what was their food plan? What have they eaten? And then obviously they go disappearing for about 3 days to try and find out what they've eaten. So it's obvious that food plans probably aren't being used as proactively as we'd all like, because if patients are taking medication, that is, of course, it will be noted and it's down, we know what they're having. We don't seem to keep a track of what patients are eating. How important is that, and how do we do it for children?
It's so difficult. What we've realised for us as MediRest is that the communication between us and the clinical teams is so key. No one hospital, no one ward, we've realised is the same, and it's figuring out what works for that particular ward, that particular staff, that specialty. And children and paediatric wards are no different. There's initiatives out there that help children become a bit more empowered to maybe record it themselves, or making a little bit more fun. So food record charts are independently carried out and filled out, and we can't just rely on busy clinical teams. We have to also be involved as a food service provider, so we make sure that we train our staff to understand if there is someone that's vulnerable, that is highlighted to the clinical member of staff that's around. But with children, there's an element of vulnerability. Where a lot of their responsibility is in our hands, either your clinical or a food service provider. It's building those relationships with the children, that trust with the parents, and making sure that we do know what the children are eating. And it is that the communication for everything is just key, like it is on other wards.
Charlotte, if people here in the room are kind of thinking something needs to happen, we need big change here, what's the first bit of advice that you would, if a catering manager, chef, nurse and dietitian came up to you and said, we need a change here with our menus, first of all, and we'll come on to parents and carers in a minute, but our menus, what's your first bit of advice?
I think it's looking at, we've had discussions around the different ages, and particularly you could be splitting it into a primary and secondary age menu, so that you've got, obviously, where you've got 0 to 18s on a ward. You can be looking at, actually, let's create even a teen menu, or obviously a younger one. But also it's getting the key people involved. So you need the buy-in from everyone, I would say, and that's where we've seen some really successful ones where you have got the buy-in from everyone. Maybe doing surveys, finding out, actually, do children like this food? Is there a menu, is there a choice on the menu that is going out that is not ever getting ordered? Why is that still on the menu? Why don't we take that off? And also then looking at not what we think that they want, what children actually are asking for. Because it's amazing, it's the people that are designing the menu, which is all of us, but we're not the one that is eating it. And yet we are telling them what to eat. Children have zero control when they're in hospital of everything. The only bit of control they have is around food, whether that's what they're ordering, when they're eating, and giving them some control back is a really, really powerful thing, I think.
we're going to be on our best behaviour today, Charlotte, which is not very often, I hasten to add, and we're not going to mention any sites. But how does it feel to you when you've gone and you've worked with a site and you've said, this is the way forward, and as soon as you get home, you get that feeling that it's not going to happen, and then you go back and it hasn't happened? First of all, one, how disappointing is that? And also, what reasons, I nearly said excuses then, what reasons do they give you that it's not going to work?
I think probably the highest reason is money. It all boils down to that so much within the NHS, isn't it? It's money. What I will say is there is money, because if other trusts are doing it, how are they doing it and others aren't? I think it's about making it a priority. You've got, whether that's children, food that needs to be, we need to look at, or whether that's parents being fed. You've got an adult staying alongside a child. It's the only ward in your hospital that you'll have that in. Yeah. There's all the other wards, you'll have those carers and they'll go home, but there is an adult on a children's ward staying in there 24/7, and they have zero access to food. And I can't understand why hospitals just aren't thinking of that. I can give you countless ways that we can find money and pots of money in your hospital, and come and reach out to us. I'll ship out Mr. Shelley if we need to. He's come on lots of visits with me, but I can have meetings with you, and we can look at where is the saving to be done. I mean, obviously, we talked, about that. It's cost £2 a head in Romford Hospital. It's not a lot of money in certain hospitals. You've just got to look at it, but you just need to make it a priority. But I can't stress enough, I could give you pages and pages and pages of families that have contacted us begging us for food because they are starving in hospital with their child. And I just think there's something wrong that we can't feed a parent when they're in hospital with their sick child.
On Sophie's bucket list, those two areas that we should be supporting. We should be improving our food for children, young people, but also for parents and carers. Katie, what have you done up at Northumbria to sort of support those people that they want to be with their children, don't they?
Yeah, so we did the voucher scheme, first of all, for parents. So when their child was in hospital, they could go down to one of our restaurants and provide one of the vouchers and get a meal up to a certain value. But I kept thinking, they're coming away from their child. I wouldn't want to leave my children, so why are we asking them to come away from the ward? Yes, it's brilliant because they're getting the money, they're getting fed, but surely we can look at a facility in the department so they can stay there and actually be able to get a meal and have a meal with their child. They should be able to pick from a menu the same as their child and sit and enjoy meals together. So we created a parents' room and put an iWave system in, using the same supplier and the same meals that we have on our current menus across the whole trust anyway. So.
And what was really obvious is when we went to ward level, all of those nurses bought into that, didn't they?
Oh, they're loving it.
Yeah, they are part of the solution, aren't they? And often, people see them as the obstacle or the barrier. It's making them part of the solution that we can find for all. Richard, how different is it when an FM provider is involved, particularly around decision making? Does that maybe drive a bit of consistency?
Yes. So what?
Hold it closer.
Closer.
So what we can do as a provider is, now we've got it working in Romford, for example, what we do is we share our best practices across all our sites within Sodexo. And we can say, right, we've built this menu, and we've already mentioned it was £2 for a breakfast and a dinner for the parent. And then we can look to bring this into all our other sites and link that in with the menus. And we simply, instead of bringing in the separate menu that was mentioned, that was going to create extra waste, extra labour time and everything. We looked at some of the more suitable dishes from the children's menu at the time, implemented that as the hot option for each of the days, and that way it was already being cooked. We just put an extra little bit in, and it works that way.
That's good.
And are your relationships, different or much the same? Because often people that are nervous that because an FM provider is involved, there's almost an extra step. You don't feel that way. You never have you?
No, not at all. And it's all about working together as a team, and just we all want the same result. We all work in the same direction.
Saachi, just to close things off, one of the things that comes to mind in particular is that, you know, we spend a lot of time mapping out the nutritional value of a meal, don't we? But if nobody has eaten that meal, the child particularly is not taking in any nutrition at all. What can trusts do? And I know we've got the digest, maybe share a little bit about what can trusts do to actually start to think about shaping their menus, anything they should bear in mind to ensure that it's all about balance.
Yeah, I think, you know, Charlotte touched on it. It's about getting people involved. You know, we always, as dietitians, always say that the nutritional value of something that's not eaten is nil. You know, we want food that looks good. We want food that's right for the people that we're catering for. And we want to get the children, the parents involved. And it's thinking about ideas of how we can do that. And yes, we can, you know, put surveys out and make sure that we get the feedback and analyse it. And that's what we do. We've got a QR code on our menus, which allows parents and children to give us direct feedback. But it's about making it fun as well. So can we get them involved in tastings? You know, what are we doing to understand what it is that children want to eat and drink? Can we look at trends in the market? You know, what are the most popular dishes? One of the things that's really good is that we like to look at school menus and see what's happening in the schools. And yes, you know, we have the digest, and it's a great document for anyone that hasn't read it, and I hope everyone has read it. You know, the BDA have written guidelines around what we need to be doing to provide food for children. But what we've recognised is that there is a bit of a gap, and we need to make things a little bit more specific for children. And I'm hoping that in the next kind of year or so, we'll have better guidance, a bit more clearer guidance for children to say, what does a good plate of food look like for children that are in hospital? Because so much of the focus is around healthy eating and guidelines like that. But we know that children in hospital are vulnerable, just like adults. But their nutritional requirements are different. You know, they're not as high, especially if you're looking at a younger child. So it's making sure that we can shape some of those guidelines and influence it at a national level, which hopefully, fingers crossed, we'll be able to give some guidance soon around that. So yeah, it's just about making sure that the voices are heard for the children and making sure that what we're offering is right for the age group that we're providing the meals for.
Thank you, Saachi. So Charlotte, your leadership has made such a difference to all of us. And you know, just the three people here on the stage, Katie, Richard and Saachi, you know, you've inspired them like you have continually inspired others in the room. Before we have a round of applause to the panel, just to let you know, we're now going to play a video, which is the creation of the second book. But a round of applause for our panel, please.
That's really quick.
Food is absolutely pivotal for children and anyone in hospital.
Food creates memories. If children are in hospital, I'd like to think that maybe the food was something that brought happiness to their day.
Prevention via good food within hospitals hopefully will stimulate a movement that outside of hospitals, parents and children want to make a difference for themselves as well. Even More Please is a sequel to the original book, More Please. It is a recipe concept book for hospitals, but it is an introduction as to how we can all be improving the food environment for children.
Sophie's Legacy is a charity set up in memory of my daughter Sophie. She was sadly diagnosed with cancer back in September 20, age 9. She died on the 18th of September 21, just turned 10. She wanted some things changed as a lasting legacy and memory. Sophie was a real foodie, yet she didn't like the food in hospital. She described it as disgusting and refused to eat. So we wanted there to be improvements to children's food. So I met with Nick Vardes from NHS Supply Chain, and he was really taken by Sophie's story. He really made a commitment that he was going to really make a difference. And he came with the idea of a cookbook.
The first recipe book was designed as an aid memoir to support child feeding in hospitals. Those trusts that have scratch cookery, i.e. the chefs cook the food for the kids. It was just to create some interest, give them some insight, but also to drive change.
Within book one, we did a lot of home-style comfort food, you know, some really great nutritious recipes, doing some research and having some insight from Sophie's legacy as well has really brought some new innovation through to the second book.
Nutrition very much represents safe care for children. At the end of the day, nutrition does form part of a child's care plan for recovery. So when they're in hospital and we're trying to nourish them to be better, they get their medication, they get the treatment plans, but food is very much part of that as well.
Nutrition for children is paramount. No child wants to be in hospital. It's absolutely important that they get those meals every day. They don't skip any, and what is in those meals is nutritional. And that's what this book and its predecessor looks to promote.
Sheffield Children's Hospital is a trust that we work with for the first book, and they've adopted 6 of the recipes. It's had a great impact on the patients. We've had lots of great feedback as well from ward staff and stuff like that, so it's really making a difference.
These initiatives help the parents and the caregivers, the patients to be able to empower themselves. It's not just in hospitals, but it's what they're going to be taken out of hospitals when they're going back home and using every day of their lives. It's easy to say, have this, have that, but really we're saying this is what it could look like, to give a bit more of an understanding and make it a bit more practical and applicable for them when they do get out of the hospital setting, when they don't have that support system, to make it a lot easier for them.
As part of the campaign, we're hoping to kind of mobilise a real change and stimulate that process for all hospitals across England. And we're hoping that the campaign not only stimulates that change for food, but specifically for children. It's about reinvigorating that passion. Food is really emotive, and so by making food enjoyable, we can help them to be able to get better.